will invite Dr. Shamya Mishra Garu, IPS, Director General of Prisons from Government of Telangana. And also invite Dr. M. Ramesh Garu, IPS, Commissioner of Police, Hyderabad, and he is leading one of India's most critical and high-density urban policing zone. We welcome you, sir. We cordially welcome you. And also, I now request Shri Venkat Changavalli Garu and CEO, Insurance Information Bureau of India, to please come on to the stage, sir. I request my team members to... okay. Presentation to Venkat Changavalli Garu by a plant presentation to Samia Madam.
ఒక్కటొకటి ఇచ్చేయండి సార్ మీరు
Request Naveen Garu to please join us here. Please join us, sir. The doctors to please join us, sir. Dr. Neelesh, sir. I request all the doctors to please join here for this awaiting moment. Thank you, sir, for coming here and gracing this occasion. Thank you very much. A small token of acknowledgement from our side.
one more
Just a word of thanks. I thank Dr. Ramesh, Dr. Samya, Venkat Changavalli Garu. All of them are here together to be with us and make this initiative a grand success. Thank you so much once again. Gurudev always says, Sangha Chatram, meaning let us move together. In togetherness, we create a beautiful nation. And I remember Dr. Abdul Kalam also saying,
proud privilege for us to start these services, and it's a very proud privilege to get it inaugurated by three very visionary people. Dr. Soumya, IPS, who is the DG of Prisons, Dr. Ramesh Garu, our commissioner here, and Changavalli, Venkat Changavalli Garu, who was the founder and starter of 108 services in the whole country. He was the person who envisaged it and started it and propagated it all over the country. It started first here in Hyderabad and then in Gujarat and then went all over the country. The reason why we are doing these ambulance services and this hotline is, I'll give you 2 or 3 statistics. People with heart attacks in any country, out of all deaths of heart attacks, half of people die before they reach the hospital. So this is true for any country, which means more important than what treatment you give after the person reaches the hospital is how quickly you can diagnose and how quickly you can shift the patient to the hospital. That is most important. And this critical time is even more important for a brain stroke. So whether you call it, time is muscle or time is brain, it's very important those first few minutes from the incident, from the start of the chest pain or symptoms of the brain stroke, how to recognize and how to get them to the hospital is very important. So we have a very dense neighborhood here. We have almost 20 to 30 apartment complexes, each with 2,000 plus apartments. So they are like villages, you know, they are huge. And to extricate a patient out of one of those complexes to a hospital sometimes takes a lot of time. So we have the advantage of running 24/7 clinics in many of these apartment complexes. So we have an emergency medical technician and nurse already present there in these apartment complexes. So what happens is we have started this emergency hotline number. It's called the chest pain or stroke hotline number. If a person experiences chest pain or symptoms of brain stroke, he can directly, he or his relative can directly call this number. It will be immediately be routed to the doctor and even to the specialist, which means to the cardiologist or the neurologist, and they can directly talk with the patient, have a video call also through a WhatsApp call or whatever, and then immediately triage them here. So that once the patient reaches here, the neurologist, the interventional neurologist or the cardiologist is ready to perform the procedure. So the whole thing goes seamlessly from the time the patient calls till it is diagnosed, till he is brought here, and the emergency services here, the doctor who gives it will be ready to do those services. So we have these guidelines, which means once a patient comes to a hospital, there is something called a door to balloon time, which means from the time a patient with a heart attack comes till you open up that artery with a balloon, that should be less than 90 minutes. In our hospital in Nizampet, it's around 37 minutes. So it is possible with hospitals with smaller size to really give very fast services. And this is what we are looking at when we start this sort of ambulance services along with the emergency hotline. So we are very, like I said, we are very privileged to have very luminary figures here. And without taking much time, I would invite first Mr. Venkat Changavalla Garu, who is the founder of 108 Services, to speak about the benefits of such a program. Thank you. Some encouragement for us.
హోలిస్టిక్ ఆసుపత్రి చైర్పర్సన్ డాక్టర్ రామచంద్ర గారు, ఈరోజు కార్యక్రమానికి ముఖ్య అతిథి డైరెక్టర్ జనరల్ ప్రిజన్స్ అండ్ కరెక్షనల్ సర్వీసెస్ డాక్టర్ సౌమ్య మిశ్రా గారు, 108 రూపశిల్పి ఫౌండర్ డాక్టర్ వెంకట్ చెంగవల్లి గారు. ఈ దేశంలో ఎమర్జెన్సీ సర్వీసెస్ అనే పేరు వింటే దాని వెనకాల వెంకట్ చెంగవల్లి గారు ఉంటారు. మరియు ఈ సభకు హాజరైనటువంటి ఇతర డాక్టర్లు, సిబ్బంది, మీడియా మిత్రులు అందరికీ నమస్కారం. హోలిస్టిక్ హాస్పిటల్ అనే ఆ పేరులోనే ఉంది ఎంత హోలిస్టిక్గా ట్రీట్మెంట్ చేస్తున్నారు. శ్రీమతి రామచంద్ర గారు శ్రీ రవిశంకర్ గారి ఫాలోవర్. ఆ హోలిస్టిక్ సిద్ధాంతాలతోనే హెల్త్ని కంప్లీట్గా ప్రివెంటివ్ కేర్ నుంచి ప్రొటెక్టివ్ కేర్ వరకు చూసుకోవడం ఈ హాస్పిటల్ ప్రత్యేకత. ఈరోజు హాస్పిటల్ సంబంధించినటువంటి ఎమర్జెన్సీ కేర్ అంబులెన్సెస్ అన్నింటినీ కూడా ప్రారంభించడానికి మమ్మల్ని ఆహ్వానించినందుకు చాలా సంతోషంగా ఉంది. వీరు ఎప్పటికీ కూడా ఈ అంబులెన్స్ సర్వీసెస్ని నిరంతరాయంగా ఎలాంటి ఇబ్బంది లేకుండా, ట్రాఫిక్ వైపు నుంచి కూడా మా సహకారం సంపూర్ణంగా ఉంటుంది, ఎలాంటి ఇబ్బందులు లేకుండా నిరంతరాయంగా ఎమర్జెన్సీ సర్వీసెస్ చేస్తారని, వారు చేపట్టినటువంటి ఇటువంటి సత్సంకల్పానికి భగవంతుడు కూడా తోడుగా ఉండాలని ప్రార్థిస్తూ నాకు ఈ అవకాశం ఇచ్చినందుకు ధన్యవాదాలు తెలుపుకుంటూ సెలవు తీసుకుంటున్నాను. జై హింద్.
Good morning to all of you who are present here. It is a privilege to be part of this significant and life-saving initiative by Sri Sri Holistic Hospitals, Kondapur, in collaboration with Red Ambulance. I extend my heartfelt appreciation to the organizers for launching the 24/7 emergency ambulance services, and most importantly for introducing the dedicated chest pain and stroke hotline. This is truly a commendable step towards strengthening emergency healthcare response. At the outset, I would like to acknowledge the distinguished dignitaries today, Dr. M. Ramesh, IPS Commissioner of Police, Hyderabad, Dr. G. Srijana, she was not able to come, I think. So Shri Venkat Changalwali, CEO, Insurance Information Bureau of India and ex-founder and CEO of 108 Services. I also extend my regards to the leadership and medical experts of Shri Shri Holistic Hospitals, Professor D. V. S. Ramachandra Garu, Chairman, Dr. Tushara Alluri Garu, Managing Director, and Dr. Subbarao Papinani, Group Director of Medical Services. Your collective vision and commitment to public health are truly inspiring. The theme of today's initiative, Every Second Matters, is not just a slogan, but a reality in emergency medicine. In cases of cardiac arrest and stroke, the first few minutes are critical. Timely intervention can save lives, prevent long-term disability, and give patients a second chance of life. In this context, I would especially like to appreciate Shri Shri Holistic Hospitals for introducing the 24/7 chest pain and stroke hotline. This initiative ensures that every medical guidance is just a phone call away, enabling early diagnosis, immediate advice, and timely action. It bridges a critical gap between the onset of symptoms and access to specialist care. The launch of 24/7 emergency ambulance services further strengthens this effort by ensuring rapid on-ground response and safe transportation. Together, these services create a comprehensive emergency care system that can significantly reduce mortality and improve patient outcomes. In today's world, where lifestyle diseases are increasing and emergencies can occur anytime, such initiatives are not just beneficial, they are essential. However, along with infrastructure, public awareness is equally important. People must recognize early warning signs like chest pain, breathlessness, sudden weakness, or difficulty in speaking, which will help them seek help immediately. I would like to emphasize the importance of collaboration between the institutions, emergency services, and the community. This initiative stands as a model of how partnerships can enhance healthcare delivery and save lives. I once again congratulate Sri Sri Holistic Hospitals and Red Ambulances for their foresight and dedication. I am confident that this initiative will serve countless people and set new standards in emergency healthcare. Let us remember, every second counts, every response matters, and every life is precious. Thank you, and I wish this noble initiative great success.
Very happy occasion after leaving EMRI almost 15 years back. This is the first time attending a hotline launch for emergencies, both for cardiac and stroke. Nice meeting you, Ramesh Garu and Soumya Garu. From the time I came to Hyderabad 21 years back, I have been knowing them. Every day today, 75,000 emergencies happen every day in this country. Out of 75,000 emergencies happening every day, 40 lakhs people are dying every day because there is no appropriate number to dial. There is no ambulance to come. There is no pre-hospital care and reaching the hospital, and within the hospital again within that time, door to balloon. We could do a little bit with 108 system, but still today we are still handling only 30 to 40% of emergencies in the country only. There is still 60% emergencies are not attended. I congratulate Dr. Ramachandra for having taken this initiative to collaborate with Red Ambulance and see that we are able to provide the required service to the cardiac and stroke patients. You require a number 108, 108 is there at the end, and 108 is the most lucky number. 1 plus 0 plus 8 is 9, and friendship comes to 108. I am glad that you have chosen this number, 88846 You require a center which can receive the calls. I am glad we have the center here, and technology to transfer the calls, and there is an ambulance well equipped. At the same time, there is a pre-hospital care inside the ambulance to come here and take the care. In those 6 years in AMR itself, we attended to 1.2 crores of emergencies by reaching in that 10 minutes and 15 minutes time. I think reach time is the most important. 5,20,000 lives we saved at that time during those 6 years. I am sure you are going to save many more lakhs of lives in holistic other than what you saved so far. In that pre-hospital care, whether we are providing airway, breathing, circulation to the patient so that he is coming in a better condition, at the same time recording the patient's vitals. We used to handle 5% of cardiac patients in total emergencies and around 1% for the stroke patients. If those could be saved additionally here, that will be the greatest contribution to the country. My request to each one of you associated with the project is, there are certain moments of truth which the patient expects. One is when he is dialing, she is dialing, our relatives are dialing. 888-46108 when they dial. How fast you are taking is number one moment of truth. Number two moment of truth is how nice you are talking when you lift the phone. Number three is how fast you are able to allocate the ambulance. Number four is how medical instructions come from here to, from specialist to the patient. Then comes reaching in time. Then comes after reaching what kind of treatment is reaching the first home. Then providing pre-hospital care inside the ambulance. Then bringing here. Then somebody waiting here to take it. When my wife had a heart failure, Dr. Ramchandra was waiting with 8 more people there to receive the patient. I reached in 7 minutes time, but he didn't wait there at that time and straight away stabilized her and took her for the that angio. That's what I am sure you will do for every patient. These are the moments of truth we have to create to people. It's not medical moments of truth. Quite a lot are non-medical of truth. Each one of the employees have to work towards that. In my experience, there are certain 10 banned words when a patient dials this number. And when he gets into ambulance, there are 10 banned words you should not use. One word is cannot. One word is impossible. One word is why. One word is should have. One word is wrong. One word is policy. This kind of words you should never use with the patient in the beginning of the sentence. It puts out the patients. Dr. Kalam told me that his mother told him, your life is successful only and only when you are able to save a life or you are able to better a life. If either of them you are able to do, this project is additionally what Holistic has been doing. In addition to that, we will be able to save more lives, we will be able to better more lives. Our Prime Minister, Mr. Narendra Modi, told me on 10th July 2010 when I met him last as the Chief Minister of Gujarat, he wrote in the book that day and told me, life is more precious when it comes back from the door of death. When a cardiac issue comes, when a stroke comes, almost the patient is nearing the door of death. This 888-46108 is really bringing him back from the door of death. That life is extremely precious. I am happy to be here today and wish this project a grand success. Thank you so much.
Within 5 minutes. అదొకటి ఇనాగ్రేట్ చేశాను అలాంగ్ విత్ రెడ్ అంబులెన్స్ ప్లస్ దీనికన్నా యూనిక్గా ఏంటంటే చెస్ట్ పెయిన్ బార్ స్ట్రోక్ హాట్ లైన్ నంబర్ ఒకటి అంటే డైరెక్ట్గా ఎవరికన్నా చెస్ట్ పెయిన్ కానీ స్ట్రోక్ సిమ్టమ్స్ కానీ వస్తే వాళ్ళు టైం వేస్ట్ చేయకుండా డైరెక్ట్గా ఆ నంబర్ కాల్ చేస్తే దే కెన్ బి అంటే డైరెక్ట్గా ఆ నంబర్ డాక్టర్కే రౌట్ అవుతుంది. అంటే చెస్ట్ పెయిన్ అంటే కార్డియాలజిస్ట్కి, స్ట్రోక్ సిమ్టమ్స్ ఉంటే న్యూరాలజిస్ట్కి, వాళ్ళు కావాలంటే వాట్సాప్ కాలో లేకపోతే వేరే వీడియో కాల్ చేసి ఇమ్మీడియట్లీ వాళ్ళని ట్రయాజ్ చేయటం. అంటే వాళ్ళు సిమ్టమ్స్ హార్ట్ అటాక్ సిమ్టమ్స్ అనుకుంటే త్వరగా హాస్పిటల్కి తీసుకురావడం, ఇమీడియట్గా పేషెంట్ ఇక్కడికి వచ్చినప్పుడు వాళ్ళు కూడా రెడీగా ఉండి ట్రీట్మెంట్ ఇవ్వడానికి రెడీగా ఉండటం. జరుగుతుంది. సో ఇది చాలా ఇంపార్టెంట్, ఎందుకంటే హార్ట్ అటాక్స్లో చనిపోయే వాళ్ళల్లో సగానికి సగం మంది హాస్పిటల్కి జారకముందే చనిపోతారు, ఏ కంట్రీలో అయినా సరే. సో మనం ట్రాక్ చేయటం అంటే ఫాస్ట్గా సిమ్టమ్స్ రికగ్నైజ్ చేయటం, వాళ్ళని హాస్పిటల్కి తీసుకురావటం, తీసుకొచ్చిన ఒక హాఫ్ అన్ అవర్ లోపలే వాళ్ళు ఫైనల్ ట్రీట్మెంట్ ఇవ్వగలగడం అనేది చాలా ఇంపార్టెంట్. సో దీనికి మనం ఈ అంబులెన్స్ సర్వీసెస్లు ప్లస్ ఈ హాట్ లైన్ కూడా ఇచ్చాం. ఇవాళ మన ప్రోగ్రామ్కి ఇనాగ్రేషన్కి వచ్చిన వెంకట్ చెంగవల్లి గారు ఈ కంట్రీలో 108 సర్వీసెస్ స్టార్ట్ చేసింది ఆయన. ముందు మనకి అసలు 108 సర్వీసెస్ ఉండేవి కాదు. రోడ్ మీద ఎవరన్నా పడిపోయినా సరే, ఎవరన్నా వేరే వాళ్ళు ఆగితే తప్ప చాలా దారుణమైన పరిస్థితి ఉండేది. సార్ 108 సర్వీసెస్ స్టార్ట్ చేసి ఫస్ట్ ఇక్కడ హైదరాబాద్లో, దాని తర్వాత గుజరాత్లో, దెన్ ఈ స్ప్రెడ్ ఇట్ ఆల్ ఓవర్ ఇండియా అండ్ వీ నౌ నో వాట్ ఈస్ 108 సర్వీసెస్. సో ఆయన కూడా కొంచెం 2 minutes మాట్లాడతారు.